Hi, everyone. Nope. Hi, everyone. My name is Kristen Herman. I am the Director of Prevention and Program Services with the Pennsylvania Coalition Against Domestic Violence, or PCADV. And I am here for our first live session of our brand new Ask an Advocate series. So we are going to be hosting these series on the last Tuesday of every month. We'll have a different advocate that comes on and talks about different issues as they relate to domestic violence. So I hope to see you at future live sessions, and thank you so much for attending our very first one. Before we get started, there's a few things that I want to go over with all of you. The first thing is please interact. You can like, you can share the video, you can comment, and we'll be taking your questions at the end. The second thing is some of the things that we talk about might be triggering or upsetting for some people who are viewing this video, and that's okay. So just a reminder that if something makes you feel uncomfortable or reminds you of something, makes you unhappy or feel unsafe, please take some time, take a break from the video and take care of yourself. And then finally, if you or someone you know is in an abusive relationship, there is help available. You can locate your local domestic violence shelter in Pennsylvania by logging onto our website. That's at pcadv.org in the Find Help section. Or if you don't have access to the internet or you don't live in Pennsylvania, you can call the National Domestic Violence Hotline. And their phone number is 1-800-799-SAFE, S-A-F-E. So that's 1-800-799-7233. All right, let's get started. So some of you might know, some of you might not know that in addition to all of the other topics we talk about in October, October is also Domestic Violence Awareness Month. And that's why we wanted to talk with you all about the theme of understanding domestic violence. But when we typically talk about domestic violence, the place that our mind goes to are different types of abuse or warning signs of abuse or statistics for who the abuse occurs to and how often it occurs. And what I really want us to focus on for this session is exploring why domestic violence exists in the first place, and then thinking about how we can prevent domestic violence. So when we talk about domestic violence and preventing domestic violence, what we really mean is making sure that people are able to have healthy relationships. And what do I mean when I say making sure that people are able to have a healthy relationship? When we look at relationships that have violence in them, when we look at patterns of abusive relationships, what we notice are different experiences people have, different things that people are exposed to that increase their likelihood or put them at risk of experiencing domestic violence. And so we call these things risk factors. Now, risk factors don't cause domestic violence. Again, they really just increase the likelihood that someone will experience domestic violence. You can have risk factors and not experience domestic violence, or you can have no risk factors and still experience domestic violence. So one example of a risk factor would be, let's say that I smoke cigarettes, and I don't, but let's say that I do. Smoking cigarettes would put me more at risk of getting asthma. It doesn't mean that I will get asthma. I can get asthma without smoking cigarettes, but smoking cigarettes is a risk factor for asthma. And we look at prevention of domestic violence in the same way. So what are some of the risk factors for domestic violence? And some of the risk factors, and this is not an exhaustive list, some of the risk factors include witnessing violence, family violence, community violence, economic hardship, financial stress, neighborhood poverty, so where it's not just individuals who are experiencing poverty, but whole communities. And then also social support for aggression towards others, which basically means anything that encourages us to solve our problems with violence or to use violence to correct any issues that we have. If you notice some of the risk factors that I just shared, whether it's, family conflict or neighborhood poverty, many of the risk factors for domestic violence are often out of our control. So if we look at things like family conflict, neighborhood poverty, we don't always get a say in whether or not we experience those risk factors. We don't always get a say in whether or not we are exposed to those things. And so prevention really becomes about, one, identifying what puts people at risk of experiencing domestic violence. Two, why does that risk exist in the first place, right? Why do we have neighborhood poverty? Why do some communities experience more violence than others? So we are identifying the risks, figuring out why they exist, and then implementing strategies, programs to directly address those risk factors. And the goal would be to lessen or remove those risks entirely. And so for domestic violence prevention specifically, there are a few strategies that we can look to. One of the first strategies is teaching safe and healthy relationship skills to youth. So this can combat some of the risk factors like family conflict or being exposed to domestic violence. Some of the other strategies include having healthy role models or building healthy relationships between adults who are influencers in the lives of children, teachers, coaches, etc., and those children. Another important strategy is creating protective environments. And this is important because, like we said, some of the things that put us at risk for domestic violence are out of our control. And those things often happen at a community level. We experience them in our communities. And so with prevention, one of our goals is to create safer communities and safer environments, with the idea being that those will then lead to safer relationships. And some ways that we can do this are in schools, we can ask students to identify safe areas of the school and unsafe areas and work to make those unsafe areas safer. We can also implement policies to make schools less tolerant or not tolerant of dating and domestic violence occurring. And then finally, when we look at things like neighborhood poverty and financial stress, if we reduce the economic stress on people, if we make sure that people are paid a livable wage and that people are paid fairly across genders, races, different jobs, then that is a strategy for the prevention of domestic violence as well. You might find yourself thinking at this point, okay, that's all good and well, that makes sense, but why is prevention important? Why should we be focusing on prevention in addition to all of these other things that we have to focus on, intervene in, et cetera, when it comes to domestic violence? And to answer that question, I want to share a couple of statistics with you first. So the first one is 1 in 4 women and 1 in 7 men will experience severe physical violence at the hands of an intimate partner. The risk factors for domestic violence, some of which we just talked about, are the same across different types of violence, meaning that if we look at a risk factor like neighborhood poverty and we work to lessen that risk factor, not only will we be lessening domestic violence or the risk of domestic violence in that community, we are also lessening the risk of child abuse, sexual abuse, youth violence, bullying, and suicide. So when we look at it from a risk factor approach, it's all connected. The third thing I want to talk about is survivors of domestic violence experience a lot of health consequences as a result of being victims of abuse. And those health consequences can be physical, they can be chronic conditions, they can be mental health. And survivors and victims of domestic violence also then become at risk of being re-victimized or being in another relationship that has domestic violence in it. And then finally, the lifetime economic or financial burden for domestic violence in Pennsylvania is $156 million in Pennsylvania. And those costs include things like productivity losses, for not being able to go to work, not feeling safe going to work, not being able to focus at work, but also healthcare costs for all of the consequences of domestic violence. In 1995, there was a study that looked at the United States as a whole and what the financial burden of domestic violence is. And in 1995, that estimate was $5.8 billion. In today's dollars, that is $9.2 billion annually that we spend on the healthcare and lost productivity associated with domestic violence in this country. Prevention is important because domestic violence is preventable. All of the risk factors that I just shared, everything we just talked about, the health conditions, the financial burdens, those things don't have to happen. We don't have to experience these consequences. And when we look at prevention, we try to do it from a hopeful perspective. So if we were to address these risk factors and create healthy communities, those healthy communities then breed and lead to healthy relationships. If we want to get ahead of this issue of domestic violence, if we want to make sure that ourselves, that our children, that future generations don't experience the risk factors that lead to domestic violence, then we need to start putting our focus into prevention. So how can this relate to you? How does prevention relate to you? And what are some everyday things that you can do? Because a lot of what I've mentioned, if we're working on community violence or family conflict, some of these things really feel out of our control. And so if at PCABV, we're working on things at the larger community level, we're working on addressing some of these risk factors, where do you all come in and where can individuals play a role in helping to prevent domestic violence? So I have some examples for you. Again, not an exhaustive list. One of the first things we can do is focused on youth. And what we can do with youth, what's important to do with youth is, one, making sure that they understand what healthy relationships are. We spend a lot of time talking to our kids and making sure that they understand different subjects, different topics, but we want to make sure that they know what a healthy relationship is supposed to look like. And that includes friendships, relationships with peers, with teachers. It's not just about dating, especially when they're younger. We also want to make sure that our youth know how to communicate in a healthy way and express their emotions. I know that some adults, perhaps myself included, have a hard time expressing our emotions and communicating. And so it's really important that whether we're not good at that because we didn't learn it, maybe we didn't have good examples, that we're making sure our kids get those communication skills and have good examples to learn from. And speaking of examples, there are a few things that parents specifically can do to help prevent domestic violence. And the first thing, and this might seem a little off base, but the the first thing that parents can do is self-care, is to take care of yourself. The relationship that we have with ourselves is probably one of, if not the most important relationship. And how we think of ourselves and how we value ourselves and how we treat ourselves affects what we will accept or not accept in a relationship. And being a parent is really hard, and that's an understatement. And so your kids are going to see how you treat yourself and how you value yourself. And they are going to take that in and treat themselves in a similar way. So it's really important that as parents, you make time to take care of yourself, because your kids need to see that that is important to prioritize. The other thing, and this is more straightforward, is just talking to your kids about healthy relationships. We have some tips for doing that on our website in our prevention section, but just starting the conversation. You can use media, you can use stories that you've heard from school or other parents to help get you started. For schools, colleges, universities, they're really interesting because what you have in a school is not just the individuals that go to that school and work at that school, but the school itself is a community. It's almost like its own little bubble society. So when we talk about doing prevention in schools, a lot of what comes to mind first for people is education in schools. And that's really important, right? Teaching about healthy relationships, communication skills, boundaries, all that sort of thing. But if we want to sustain what those students are learning, and if we want to make sure, again, that people are able to have healthy relationships, we need to make sure that the community of the school is safer. And that can be done, again, through having students identify safe or unsafe areas of the school, or by implementing policies. And then what we can do in communities, we just discussed, healthier communities lead to healthier relationships, less risk factors, less likelihood of experiencing domestic violence, less domestic violence. And anything in a community that will increase resources, increase access to resources, and really increase a community's feeling of being connected and supported, those things will help to prevent domestic violence as well. So if you're really involved in your community, you notice some gaps, there is a place where you could also play a role. And then just for everyone, you can visit pcadv.org and check out our About Abuse section. It might not feel relevant to you right now, but this is information that's good to know, and I think would be really helpful to you in the future. You can also practice setting healthy boundaries or practice healthy communication in your own relationships. And again, relationships, friendships, coworkers, and dating relationships. It's not just about healthy relationships for dating. And then having conversations with people in your life about relationships or different things we saw in the media that we feel are related, etc. So there's one more thing that I want to make sure that we go over, and it can be challenging to explain, but I also think that it's really important to help understand prevention and how we prevent domestic violence. So, reminder, please interact, please ask questions if you have any, if anything that I'm saying you need some more information on. So we're going to talk about intersectionality. Intersectionality and why it's important to prevention. The burden of domestic violence, the rates of domestic violence are not the same among different groups. The risk factors for domestic violence affect different groups of people more than others. So for example, communities of color, LGBTQIA communities, immigrant communities, religious minority communities, women, of course, these groups experience higher risk factors and therefore higher rates of domestic violence than people who don't identify with disadvantaged communities or don't identify with as many disadvantaged communities. And if we think about it from a larger sort of cultural, societal perspective, it makes sense, right? Because people who identify with disadvantaged groups in our society experience more discrimination and less power. So it makes sense that if people are experiencing less power in our society, and that power could be through education, could be financially, could be just in the way that people perceive you based on your race, your gender, your sexual orientation. But if society gives these people less power, it makes sense then that they will also experience less power in their relationships. And that's why it's important to look at prevention from the perspective of risk factors, from acknowledging that some of the things that put us at risk for domestic violence are out of our control. And that's not to say that people who don't experience oppressions or experience less or different types of oppressions can experience abuse. And it doesn't mean that their experiences aren't valid. The way that we look at it is if we can help the person with the most disadvantages, with the most risk factors for domestic violence, then what we will be doing is naturally helping others who have different or a different combination of those risk factors. And so what intersectionality is understanding that as individual people, we identify with multiple identities. So for example, identities could be that you're a woman, or that you are a Black woman, or that you are a Black woman who is a member of the LGBTQIA community. And so these identities we can identify with one, we can identify with more than one, and they overlap and they affect how we experience domestic violence. And so really in prevention, we use intersectionality as a reminder that if we are working to lessen risk factors like neighborhood poverty, like financial stress or hardship, we need to make sure that those strategies acknowledge people of all identities and equally support people of all identities. And so that's really intersectionality. It's a reminder that domestic violence isn't just about women who experience domestic violence. It is that multiple people can experience domestic violence, and based on our identities, that can impact how often, how much, how likely we are to be in an abusive relationship. So thank you for sticking with me. Before we get to some questions, I just want to give a quick reminder of things that you can do to get involved in our movement. So I talked through some strategies specific to prevention that you can do. But if you're interested in getting involved or helping out the domestic violence movement, the movement to end domestic violence, there's a couple of things that you can do. If you're in Pennsylvania or any state, but if you're in Pennsylvania, you can volunteer with your local program, and you can find your local program on our website at pcadv.org. Another thing that you could do is you can donate to PCADV to support our prevention and our intervention services. PCADV supports 59 local domestic violence programs across the state of Pennsylvania, providing training, technical assistance, resources, research. And so your support really helps us ensure that we can provide that support and that information consistently throughout the year and at a high quality. And then you can participate in our upcoming #HearMeOut campaign, which works to engage men specifically in the movement to address and end domestic violence. So with that said, let's go ahead and take some questions. So our first question is, what do you mean by healthy relationships? Good question. We did talk about those. So healthy relationships have a few characteristics that we would want to see. And a lot of times when we talk about domestic violence, we talk about what are the warning signs or what are the things that we don't want to see in relationships. So in a healthy relationship, we would want to see something like trust as opposed to jealousy. We would want to see boundaries, individual boundaries, physical space boundaries, but also mental boundaries. So allowing people to have their own beliefs and, do their own thing, hang out with their own friends, etc. We also would want to see healthy communication, honest communication, and equality among both of the people. So those are some of the things that we would like to see or that we would define as characteristics of a healthy relationship. The second question is, why do you think the term prevention is overlooked? That's a really good question. So I think that in our culture, we are very reactive. We wait for issues to happen and then we address those issues. There's a crisis, something bad happens, we realize it's a problem, now we work to fix it. And I think that's why prevention gets overlooked, because when we start the process, we're starting where something already happened. And when we talk about prevention, we want to start before that thing had a chance to occur. And I think that's why prevention gets overlooked, just because we typically deal with our problems in a very reactive way. Okay, next question. Can we really do prevention without legislative or public policy support? Okay. I think it feels like this question comes from some of the strategies that we talked about for prevention. So some of them feel really big, like we have to make policy change in order to see sustainable change. And while that's something that we want to see, we can still certainly work towards prevention and have successful prevention programs and strategies without that support. And what that would look like would be you doing things as an individual, so talking about healthy relationships, participating with your community in identifying unsafe areas of your community or some of those risk factors that you experience. And then if you're an organization that's working on prevention, you can do this work really by building relationships with the community that you want to work in and letting them guide your work. So rather than always thinking of prevention as sort of a top-down approach, we have to have the policies in order to get the individual change, we can look at it as we want to have the policies, but we can start with the local communities. We can start really from a grassroots perspective. Do I have any recommendations for advocates? Advocates doing prevention work? Okay. Yeah, what I would say for advocates doing prevention work is don't assume that you know what your community needs. We get caught up in that a lot, right? Because we know the risk factors and We don't have a ton of research on domestic violence, but we have enough to guide us in certain directions. And when we get to communities, schools, youth groups, we go in with the notion of what is it our goal to get across? And sometimes in that process, we can forget to ask communities, what is it that they need? And what, according to them, are the biggest problems in their community. And that can be done informally. You can do focus groups. We have different models that we could suggest for you to use. And then for advocates, you can also do that within your organization. Really do an assessment of what folks think about prevention, what they feel the issues to be, and go at it from that perspective. Okay, so those were all the questions we had today. Thank you everyone so much for joining us. I hope that you learned a lot. I hope that this was helpful for you. Our next live session is going to be, I'm going to check my notes, is going to be on Tuesday, November 6th at the same time, 1 p.m. Eastern. So I hope that you'll tune in live with us then. And until then, we'll see you later. Thanks, everyone. Bye.